Good evening, friends. I'm SUMI PRATHAP, one of the OET aspirant in Edu Skills. First of all, I'd like to thank to Father Saleen Joseph and admin panel members who's encouraging always behind to us to learn more regarding the OET. So you all know about this Edu Skills International platform is free, right? And you can encourage others also to join to learn OET. Okay, we have put also that encourage each other and grow together. So kindly help others to join to the Edu Skills platform. Okay, so that they also can learn same like us. So today our discussion topic is writing, subtext, and grammar. All of you know why it's important grammar in the writing.
Yes, ma'am, because in the writing we can use three type of sentence: simple sentence, complex sentence, and compound sentence.
Tense, why it's important? Why the tense are important in OET writing is we have four modules. It's very important tenses. Okay, we cannot say in the present tense. We cannot say in the past tense. Okay, so it's very important for all modules. When it's come to the OET writing, it's using the appropriate tense. Ensure that the reader understands the patient current condition, medical history, and the recommended future actions. So if we will write something different tense in a particular place, it will be wrong. Okay. So misuse of tenses can lead to the confusion, misinterpretation, and potential risk to the patient care. Okay. For examples, we can see here, Mr. X. Always in the writing, we are using third person, right? The patient name. So we are using pronoun is she, her, right? We are using like this. So we can use only the third person tenses only. Okay, no need to know all the one. Of course, it's needed, but learning for the writing only it's enough for that. Only third person tenses we can use it here. Okay. For example, Mr. X experiences chest pain because is the third person. When verb it comes, we have to write yes. Okay, this is present simple tense. When we are writing according to the context, okay, if it is present tense we are writing, if you will write here without s, or if past tense if without ed, it will be wrong. Okay, so we have to be very particularly, we should know that where to write ed past tense, where to write yes present tense. Okay, so we are using the patient is a male or female. This is the only we will use, right? So here she requires, of course we have to write this, she requires occupational therapy. Okay, so keep it in your mind that therapy, whenever you are seeing that physical therapy, occupational therapy, in some other therapy, no articles for that. Okay, so we will start the use of tenses. There is a lot of tenses, more than 10 tenses we have, but for the writing, I hope this four is enough. Okay, present tense and using the past tense, past simple, and using the present perfect and present continuous or progress. Okay, so this four tenses is enough for us to score a grade A. Okay, one by one we can see that. First, we will see the use of present simple tense. Okay, present simple tense, that is do, make, come. According to the subject, it will change. Okay, why we have to use present simple tense and where to use the simple present tense. Okay, why? To report unchanging facts, information is true in the present and it's not subject to the change anytime soon. Okay, it will not change immediately. Okay, in that condition we can use for the present simple tense. Where to use in the writing? that is beginning of the letter. Okay, when we are writing introduction paragraph, we used to write that the patient name. Okay, we are not allowed to use the patient. Okay, patient name you have to tell. Okay, if we are using second name, you have to tell second name. If there is title, must to write title, but never change your pronoun. If you are writing female, must be she, her, her. Okay, if it is a male, we have to write is or him. Okay, this will be it will be wrong, means we will be considered minus marks. Okay, so we have to be careful with that. And this is the one, when introduction paragraph we have to write like this: the patient is 29 years old. There is hyphen, this is typing mistakes all from that. She is divorced and has two dependent children. Okay, so this is present simple tense. As two children, okay, this is fact, and soon it will not change also. And as we can use like a present simple tense also when we are talking now. Okay, like as two dependent children, it will not change. Maybe yesterday she born and today she will be alive, tomorrow also she will be alive. Yeah, it will not change immediately, right? So we can write there present simple tense. And also the patient is allergic to penicillin. So kind of the words we can write like this. Okay, penicillin. Then to provide the patient unchanging status and profile. Okay, then we can see step by step where to use. Okay, when to use, how to use, we can see that. First one is when something happens on a regular basis. Okay, so for a frequent, and happens now. Frequently, maybe yesterday it's happened. Again, patient is complaining today also the same symptoms. Okay, in that case we can write. Okay, the Mr. James experiences, okay, chest tightness. He experienced chest tightness on a regular basis. Okay, happening frequently, and now is having this chest tightness. Okay, so we can write in the case of frequently if the patient is complaining of the pain. Okay, second, we can go for that for the details such as lifestyle choices. The present tense is appropriate. When we can tell that despite previous advice we given to the patient is to not to smoke, but still patient is smoking. Okay, 20 cigarettes a day. So this is the lifestyle choice that patient is having. So kind of that maybe it's drinking every day and smoking every day per day this much of amount. Whatever context given in the question paper, we have to write according to that. Okay, what they given. Only is they are telling that smoking only, we can tell that still is smoking. If they are giving 20 cigarettes a day, that also we have to mention. So next, when we have to use present simple tense, we can see that to describe the patient current social background. Okay, the examples given down. Mr. James smokes 20 cigarettes and drinks 2 bottles of wine. Okay, see, this is continuously is doing that. So we can tell that, okay, the reader will be understand this one. So now also the patient is drinking and smoking. So it's very easy to understand this one. Present, the patient is doing this. Okay, Miss Jessica is overweight and has a BMI. We cannot write that Jessica is overweight. Okay, that is judgmental word, but we can add like this and as a BMI of 27.8. Okay, so this will not be considered as a judgmental word. Okay, we cannot write that patient is overweight. He is overweight. You're right. In the speaking, we cannot tell that you're too much weight and you have to reduce your weight. So, like this, judgmental words we are not allowed to use. Okay. And next one, we can use the situation is next we can use that to describe anything that occurred during hospitalization. Okay, that is still continuing. That means yesterday maybe admitted. Okay, still the patient is continuing on the antibiotics. that we can write. Okay, still in the hospital, that we are not discharging the patient, just we are writing letter that the patient is going to be transferred or discharged. So the patient still during the hospital time, whatever is happened, and still the continuing until now, we can write that also. For example, is given here, Mr. James needs assistance. Needs. Kindly follow that wherever the verbs is there, all be written that needs. Okay. Yes, we are adding S also. Okay, we have to careful with that. Yes. Okay, Mr. James needs assistance with dressing, toileting, and transferring. The next one is Miss Jessica consumes. Yes, there is. Yeah, right. A low calorie diet in order to maintain a weight. This is the one when patient is in the during hospitalization, still is continuing means we have to write this one. The simple present tense, just I written that is all fathers. I don't know how many of you watch father's video, that all PPT is taken from the father's video. I did not explain as father explained. So kindly watch father's video to more clarification about this all, right? So here we can see that I made a simple tenses here. Keep it in your mind that present simple tense where to use. Habits, routines, facts, and general truths. Down we given the examples. That is, Mr. Philip leaves alone and uses a wheelchair. Okay, the patient leaves. This is important that we are writing the background, right? That time you can write like this. The patient leaves alone and uses a wheelchair. Okay, and he is a regular smoker. See, there is a regular smoker. Okay, so when regular come means no need yes to join here. Regular is already usually. Okay, it's routine. So we can keep like this. Okay, she walks slowly with the help of his wife. And down I told you that as we can use as a present tense. Okay, in some places, not all the times. Okay, she has a fracture in her right ankle. Mr. Smith has chronic asthma. Chronic asthma is continuous, right? Routine. Always she is having chronic asthma. So we can use in this place that as. She has a history of means it's not started today. Okay, it was started yesterday. Now also she is having severe chest pain. I hope is present simple tense is clear for you all. So now we will go for the use of past simple tense. Okay. Now past tense. It will not come to the present tense. Okay. It's already completed. Completed action. Okay. The action is already completed maybe yesterday, maybe 1 hour before, maybe 1 minute before. It's already completed. Okay. It's not come to the present tense. Okay. So this will be the past tense. So we can see where to use and how to use. For examples also we can see useful in your referral letter, discharge letter to provide background information, okay, which has been specifically linked to your past time period. Okay, it's already finished. Okay, but it's linked. Okay, for ongoing conditions still not resolved in kind of way, we can write use the past simple tense. Okay, the patient first presented 2 months ago with the bowel compliance. Now she displayed symptoms consistent with the IBS. Okay, using the past simple for background because we are referring to something which occurred in the past that we have to inform. Where the patient is having chest pain last week, and he took medication and he resolved. Again, he came back night only and he was admitted here means we have to explain that he's regularly having this chest pain, but the past he resolved and again he came back. So this information we have to tell. Okay, so next we can see past tense where to use. Okay, when describing an event in the past. Okay, Mr. James experienced chest tightness. Okay, in the past he experienced, maybe we given the medication and he resolved an event discharge. Okay, again he came back with a chest pain and maybe diagnosed of MI. So this past tense also we have to inform them that the patient came like this. Okay, but we have to use past tense only for that. Okay, when describing an event in the past which is resolved. Okay, the Miss Catherine gave birth 5 weeks ago. So conciseness is very important. So just we written here, Mrs. Catherine gave birth 5 weeks ago. That means she given birth. There is no complication. Baby and mother both of them fine. Okay, with this sentence, it's already fully understood. Okay, so no need to tell that there is no complication, there is nothing. So no need to write everything. Okay, conciseness is very important. Mr. Catherine gave birth 5 weeks ago. Maybe we can add that both of them normal also. Okay, doesn't matter. But even if you will not write also, it's okay. So next we can see that with diagnosed. Okay, Mr. Catherine was diagnosed with pneumonia and treated with antibiotics prior to discharge last week. Okay, so pneumonia is now resolved. Okay, so this kind of word that patient already resolved, we can write use the past simple tense. Okay, the fourth one is when the situation is ongoing but is stable. For example, diabetes, the patient is started in 2018, okay, but still is managing with the medication. That we can explain that Mr. Catherine was diagnosed with diabetes in 2018, for which she takes regular medication. Okay, she is managing, but she was they already the time phrase they given here in 2018. Okay, she was diagnosed, but still she is managing with a regular medication. Okay, that we have to tell. Okay, although this patient still has diabetes, the diagnosis is considered a complete event now that the condition is stabilized. Okay, so we have to be careful when we are writing past tense. If it is finished, okay, we can write. If it is finished and still continuing something unstable, okay, that kind of situation we can write. Okay, this is the past tense. Okay, we can see down there is some examples we given. She was comments on metformin. Okay, always was is always the passive voice. Okay, and she was comments on is preposition pre- preposition to the commenced. Okay, we cannot write this commenced with. It's wrong, and here there is no was also. Okay, we have to be particularly should know where to write, where to use the passive voice, where to use the active voice. This will take little bit longer, so just we will go through today the tenses only, these four tenses. Okay, so she was commenced on metformin. The second also there is one example here. 3 units of packed red blood cell was transfused. Okay. See, there is plural 3 units, right? 3 units means it's plural. So there we cannot write the was. So we have to write here where. So this was where both of them considered as a passive voice. But we have to consider the subject also. 3 units of packed cells, okay, were transfused. Okay, this is past tense. And one more last for the past tense where to use in the case notes. When patient is admitting, immediately we are doing that lab results and the examination immediately. Doctors immediately they will do the examinations, right? So this all, of course, we cannot tell that present tense. He admitted 2 days, is treating in the hospital, and he is going for the discharge or transfer. So, kind of this vital signs and test results we can write in the past tense, okay, which were accurate at the time of the visit. The past tense is appropriate, okay. For example, given down on examination, the abdomen was tended on palpation. So this is during the admission on examination was done. So this is past tense we have to use. This is really appropriate to write the past tense kind of situations. So now we will move to the present progressive or present continuous. Okay. Example is doing, is making, is coming. So according to the context, it will change. Okay. We will see where to use, when to use. The patient's condition is deteriorating. Our patient is refusing to take a medications. For example, patient admitted during admission, he was okay to take all the things. Okay, he was taking medications, but now is refusing to take medications. Maybe he was admitted normal way with the anxiety, with the stress. Maybe now he is deteriorating. So when it's coming, the situation is progression. Something problem is progress. That time we have to use the present progressive. Okay, that is the one written here. Skill is contrast. Communication, the situation in the present is different from the situation in the past. Okay. In the past, the patient condition was not deteriorating, but now it is. In the past, the patient was not refusing to take her medication. Now she is. Okay. Kind of situations we have to check in the case note. According to the context, we can write. Okay. Next one, we can see the example here. When describing an event currently currently happening, okay, that we can write here. Mr. James is experiencing chest tightness. Okay, this is something progress. Okay, experiencing right now. Currently is experiencing. Okay, so kind of words. If it is progressive, if it is continuous, the same pain, we can write. We can see here examples given here, present continuous or progressive tense. We can see here the present continuous is employed to describe actions that are ongoing at or around the moment of speaking or writing. Okay, both we can use the tenses. Now the present continuous will be given here some examples. We can see that her condition is deteriorating. She is refusing to take her medication. Okay. Mr. John is responding well to the new treatment regimen. Okay, this is maybe before he was not, responding to the treatment. Now he is responding to the treatment. Mrs. Asma is experiencing severe back pain. Okay, she is currently taking 2 tablets daily. Okay, this is the one. So we can see this sentence. Just keep it with you, and whenever you're seeing the letter, okay, according to that, you can match with this and you can write the letters. Okay. The fourth one, we can go for present perfect. Okay, which is always we are using in the writing letter. It's very important, this one. Using the present perfect always will be as done, as made, as come. Okay. But when it comes to the present perfect, there is structure for this: subject plus as or have. Before I told you that we are using always the patient third person. So just as is okay. Okay. Then we have to write verb 3. Verb 3 we have to write. Okay. Like for example, we can tell here the condition as steadily improved. Okay, improve, improves, improve. This is V3 we have to write. Okay, so keep it in your mind that always there is present perfect if we are using as plus V3. That means we have to join the ED to the verb. Okay, for examples, we can see here his condition as steadily improved, right? Her health has slowly deteriorated. He has regained some mobility since starting physical therapy. Okay, her breathing has gradually improved since being treated. Over 2 months, his weight has, this is linked to the past. Past it started and still is continuing that the same. Okay, in kind of that situation, we can write the present perfect. Okay. The medication has been prescribed since her last appointment. So this is as been when it will come to the passive voice. Okay, we have to use as or as been according to the context. Okay, all the time we cannot use this as been. Okay, as been, there is some words we can use, some words we cannot use. Okay, I'll post it in the main platform that where to use as been, where cannot be used the as been. Okay, just follow that because we forgot to take that. And regular checkup have been scheduled to monitor his or her over health. Okay, we can see in the left side, for example, where to use the present perfect. Okay, for details which describe unresolved situations such as improvement or deterioration in the patient condition. Okay, so that is the time we have to use this present perfect. The example is given here. Since his last visit, Mr. John's pain levels have reduced, okay, from an 8 to a 4. Okay, this article is also important. I think Sabari Lakshmi already she discussed with you all where to write this and articles, right? So we have to be careful when we are writing this one. Tenses important. Articles very important. Okay, everything. The connector is important. We should know where to use this connector for which it took the medication. That we cannot tell that simply something. For example, physiotherapy we started, right? For what we started, we have to connect the both of them. Patient cannot walk properly, therefore we started the physiotherapy. So we should know the context. We cannot write that a patient cannot walk, so dietitian seen. So this all wrong. Okay, we should connect. We should know how to connect the sentence. Okay, for the diet, if we are talking, we have to write only the dietitian. Okay, if we are talking about the patient cannot walk and is having something problem in his leg and post op physiotherapy, we have to talk to physiotherapy. Okay, for the medications also, if the patient is having some pain, we have to start the medication only. We cannot write for that everything like a physiotherapy started and is walking everything, then come for the medication. It's not the correct sentence. Okay, first patient is having some problem, then for which we started this medication. Then only we go for also we can add. Also we can add. Therefore, we refer to the physiotherapist like that. We can go for that. Okay. So now we can see some. The last one we can see that what is that? Present perfect where to use to discuss an action that has just been completed. Okay, recently completed. That we can write as a past present perfect tense. Okay, she has taken a course of antibiotics. That means she already taken, completed the course. Okay, but we are endorsing to someone. That means we can use this one as taken. Okay, the surgeon has performed the hip replacement. Also, just completed. Okay, just completed. Maybe the 2 hours before or the last night it's finished. That means we can use this present perfect tense. Okay, he has been advised to get more rest. Okay, maybe that is the word. Just completed everything. That still we are endorsing to someone or we are writing someone. We can use just completed. Okay, just being completed situation. We can use the present perfect tense. Okay. Next, we can see that some examples that a past event that as linked to now. It can also describe experiences or changes that have occurred over time. Okay, then examples here given. Mrs. X has shown significant improvements since starting the treatment. She has had eczema since she was a child. Okay, she is having since childhood. So this one we can write as had eczema. Okay, she has expressed concern about potential side effects. The down I given that. what is the context that they are giving in the letter. 2016 peripheral artery disease diagnosed. Okay, and 2019 intermittent claudication diagnosed. Okay, this is the one they will give in the question paper. This is the context. How we will write the down examples given. She has had peripheral artery disease for 5 years. Already father also taken that for 5 years. Okay, since 2016. The for 5 years is the duration of the period. We can use this for 5 years. Okay, since sorry, for 5 years we can use for the particular time. Okay, since 2006 is from that time onwards until now she is having, that means period of time. Okay, the since we have to use here, the for one is period of the particular time. Okay, so as add intermittent claudication since 2019, which causes calf pain if she walks more than 10 meters. Okay, the patient has experienced a stroke since 2019. Okay, this is correct. But in 2019 is wrong. Okay, in 2009 means it's already completed. So we cannot tell now. So this is wrong. We can use this one when we can remove this as, then we can tell simple past tense in 2019. Okay, but we cannot write in 2019 when we are writing this as experienced. Okay, we cannot use in the present perfect tense. Okay, next we can see that where to use clues in the case notes, the same the time phrases for and since. Okay, the patient has received massage therapy for the last 5 months. Okay, for 5 months he is on this massage therapy. In that situation, we can use for. Okay, since 2006, we can write that 2016 or whatever is there, whatever given in the case notes, we have to follow that. Then final one is it's not in our list, but still just explaining that request paragraph. Okay, request paragraph mostly we are using that model verbs. Okay, how to use model verbs? Just there is a 5 sentence. Just we made it. That is, she should be referred to a specialist. Specialist, as I mentioned before, if we are telling the specialist, we have to write article okay, so a specialist pain clinic. Okay, because this B is in the future tense. Okay, that is the already I said there is a B was where, same like that should be. Okay, B is a passive voice. Whenever it's come to the passive voice, we have to do B3. So in the bracket, I written that subject plus should plus be. Mostly we are using modal verb B1. But when it's come to the B, should be, could be, would be, that time we have to use verb 3. Okay, referred. Okay, prescribed, commands. It's like that. ED we have to join if we are writing B. Okay, she was referred for evaluation and treatment. This is passive voice. Okay, then third one is it would be appreciated if you could. See, the first sentence would be appreciated. There is verb 3, right? Then if you could monitor, only we are writing could, only modal verb, we have to use monitor. That means verb 1. Okay, this medication compliance. Please could you encourage, say that is only verb 1, him to do more exercise. It would be grateful, if you could monitor his diet. I hope request paragraph we have to write like this. Okay, we are requesting to them. That means we have to talk politely, write politely. Okay, so should be, would be, could be. This is more formal words that we can use model verbs in the writing for request paragraph. Okay, I hope it's clear. Down we can see that tenses. So this is, I think, all completed by Priya, Shanmuga Priya. So this is present simple tense. Okay, we can see this. Examine plus S. For the third person, eat. Like that, we can use this yes. Okay. The passive voice we can use is or examine. Past simple tense, examine for the active voice. Passive voice was, were, examine. Future simple, will examine, will be examined. Okay. Present continuous, this all, we don't need this one. Okay, there is only present continuous we can use, but somewhere only we are using no. So this all no need for explaining. The last one recap, we can see that present tense, present simple for something which is unchanging, likely to be true for a long time. Okay, this is only we can use in the patient's profile background, like that we can write in that. Okay, the use past simple for background information set specifically in the past background of the patient. Okay, there we can write present perfect for information which links to the past to the present. Okay, responses to the patient condition which are consistent with the past, which doesn't have a specific time reference, or use a time reference with the for or since. We can use this. Okay, for or since we can use. Okay, present continuous for currently information which requires. Okay, present reaction or response. So already clearly explained previously. So this is a recap that where to use, how to use. I hope it's clear. Thank you.
Thank you, Sumi, for the session.
Yeah, ma'am. With the help of these tenses, 4 tenses, we able to complete the writing test, ma'am.
Yes, you can. Not only the four is here. No, there is modal verbs also there for the request paragraph, and a passive, active. We can write, and present tense, past tense, present perfect, and present progressive. Almost you have eight tenses. Variety of tenses we have to write in the letter writing that you have already here. Okay, there is father's video in the YouTube. You have to watch all the writing modules. Okay, whatever we have in the website letters already explained clearly how to select the case notes, how to write simple sentence, and how to convert to the complex compound. Okay, all he explained clearly in the writing sessions. Okay, there is all the videos uploaded.
Okay. Thank you, ma'am. Thanks a lot. It's really helpful
Thank
to
you.
us. Yeah.
Thank you.
Thanks to father also, because lot of things is giving with a detailed one. Really, I like father very much, and you people all. And thank you, ma'am. Because hereafter I have to see these all. Now I am focusing only on reading. Step by step, as father and admin people, what you people are guiding us, we will follow that. Thank you, ma'am.